To FOX10 News at 4. Pharmacists play a very important role in our everyday lives, and when you think of one, you probably think of the person standing behind the counter, right, when you're going to get your prescription. We're going to talk more about that and expand on that role in hospitals when we're talking about our pharmacists. We have two special guests here. I will let you guys introduce yourselves. Starting with you, Jeff.
My name is Jeff Bruni.
And
I'm Giovanna Brannon.
Okay, awesome. So the first thing, as we said, when people hear the word pharmacist, that's immediately who they visualize, the person behind that counter, but it is a bit more than that.
Definitely so. Community pharmacists are very important, and in the hospital it's a little bit different since we're more of a behind-the-scenes person, and the patient may not see us face-to-face like they do in the community. In the hospital there are some differences though, as we do patient care rounding with multidisciplinary teams. We verify all the medications that are administered to a patient during their hospital stay. We complete consults for providers to manage therapy with certain medications, and we manage patient care in a more of an acute treatment setting. Also in the hospital we're able to do personalized medication regimens based off lab values that we can order. And this can range from providing extra electrolytes to altering antibiotic therapy.
And if a person has had a recent procedure, or if they've been in the hospital at all, they know that pharmacists at the hospital very well, because that's also the person that gives them their medications before they get to go home. I want to talk about the training that's involved.
Yeah, absolutely. So honestly, after graduating with a doctorate in pharmacy, there are many different avenues that pharmacists can go into. Some choose to go into a more community-based setting in that retail world, or sometimes in clinics where they work with our patients directly, and others are like us when we are in hospitals and we're working with physicians and nurses. When it comes to the training, there's usually a first-year residency program that provides that foundation, general clinical skills, and develops further on that. But there are second years where you can actually specialize in certain areas such as oncology, critical care, pediatrics, and many more. Besides that, we do have fellowship programs as well, and in those programs they focus more on research and pharmaceutical industry. But all to say that all these types of trainings really do help provide more of an avenue for these pharmacists to expand on their specific interests as well as to the care that the patients need.
I'm glad that you mentioned patient care. I'm guessing that's why the both of you decided to go into this profession.
Yes, ma'am. Yeah, that's something that I love to talk about. When I think about residency in my experience, I think the best thing that has happened to me has been this residency program and having my fellow residents and getting the experience that I've had at infirmary health. And by being a part of the infirmary health system, it's provided me with the opportunity to see a lot of patients that have come in with a wide range of health conditions, from cardiac to neuro to critical care, as well as a variety of services and surgeries that we provide in our health system. And that provides us with the opportunity to not only see a lot, but to also do a lot when it comes to patient care. And so for Mobile Infirmary, we have pharmacists in all of our intensive care units. We have them in the nursing units on the med-surg floors, and we also have them in a variety of specialty areas. And by us doing rotations through those respective areas, it really does provide us with the education and the knowledge, as well as the ability to better serve our patients.
Oh, for sure. And on that note, and I'll give you the last word, talking about the knowledge that goes into that, what are you hearing in schools or as people are seeking out professions? Is this still as popular as it once was? Like 2 years ago, everyone wanted to be a pharmacist.
Yeah, absolutely. And I think honestly, this continues to be a growing field because of the many training opportunities that we have available and the vast amount of knowledge there is to learn in our industry. So really the takeaway is that there's a lot of training opportunities in infirmary health across the state and across the country. And so just think about this, wherever there are medications, there's going to be a pharmacist too.
That's right, and there's going to be a need always. So thank you both for stopping in to elaborate on this.